If you're over 70, chances are you've been told that regular checkups and more medical tests are the secret to a longer, healthier life. After all, early detection saves lives, right? Well, not always. In fact, many seniors today are quietly overtested, overdiagnosed, and even overtreated. And the truth is, some medical checkups can actually do more harm than good once you reach your 70s. That might sound shocking, but let's unpack why. As we age, our bodies change, and so does the way we respond to medical tests. For example, certain screenings that were once beneficial in your 50s or 60s may become unnecessary, inaccurate, or even risky after 70. Why? Because older adults have a different balance between risk and benefit. A test that detects something abnormal may lead to stressful procedures, biopsies, or medications when, in reality, that problem might never have affected your quality of life. Take this simple truth: not every abnormal result means disease. And not every disease needs treatment, especially if it's slow-growing, harmless, or unlikely to impact your remaining years. Let's understand this through a story. Meet Mr. Rashid, a 74-year-old retired teacher who lived a peaceful life with his wife. He went for a routine full-body checkup at the insistence of a friend. One of the tests showed a small prostate nodule, something very common in older men. Alarmed, his doctor ordered a biopsy. The procedure caused bleeding and infection, and eventually, Rashid's calm, active life was replaced by months of stress and fear. Later, another specialist told him, "This would never have hurt you in your lifetime." Stories like this are far too common, and not just among men. Women, too, undergo unnecessary mammograms, bone scans, and other repeated tests that may show harmless abnormalities, leading to anxiety and overtreatment. The hidden cost of overtesting. Many seniors assume that saying yes to every test means taking control of their health. But in reality, the best control comes from wisdom, not fear. Modern medicine is powerful, but even the best test can produce false positives. In older adults, these false alarms can trigger a chain reaction: hospital visits, medications, side effects, and emotional stress. Let's break down some of the main reasons why unnecessary checkups can harm seniors. 1. False positives. Older bodies show many harmless changes that look abnormal, but are not dangerous. 2. Radiation exposure. Some imaging tests, like CT scans, involve radiation that accumulates over time. 3. Emotional toll. Waiting for results or facing unnecessary diagnoses increases stress and anxiety. 4. Overtreatment. Procedures or medications may cause complications worse than the original problem. 5. Quality of life. Time spent worrying about small test results can steal precious moments of joy and peace. The wisdom shift after 70. Here's something powerful to remember. After 70, health is about balance, not perfection. Instead of chasing every possible disease, the goal should shift toward maintaining function, comfort, and emotional peace. This is what geriatric medicine emphasizes. Today, a focus on quality of life, rather than endless scanning for potential problems. Doctors now recommend personalized screening, meaning your medical tests should depend on your overall health, life expectancy, and individual goals. For example, if you're a healthy, 72-year-old woman who exercises daily and has no symptoms, doing certain screenings every year might offer no real benefit. On the other hand, if you have specific risk factors or family history, targeted checkups might still be wise. The secret lies in individualized care, not the one-size-fits-all approach. Aging smart. The power of informed choice. Imagine health in your 70s as a garden. You don't need to water every single leaf. You just need to care for the roots. Similarly, you don't need every test. You need the right ones that nurture your body and peace of mind. This video will explore 5 specific checkups that seniors over 70 should think twice about and what to do instead to protect your health naturally and safely. But before we dive into those 3, remember this golden rule. Medicine is not just about adding years to life, but adding life to your years. In the next section, we'll begin with the first checkup you might want to avoid, and the science behind why skipping it can sometimes save you from harm. Now that we understand why more testing isn't always better, let's begin with the first medical checkup that seniors over 70 should reconsider: the PSA test, commonly used to screen for prostate cancer in men. Understanding the PSA test. The PSA, prostate-specific antigen test, measures the level of a specific protein produced by the prostate gland. Higher PSA levels can sometimes signal prostate cancer. Sounds simple, right? Just a blood test to detect cancer early. But here's the catch. PSA levels can rise for many harmless reasons, such as prostate enlargement, which happens naturally with age, mild inflammation, or even after certain physical activities. So, a high PSA doesn't always mean cancer. In men over 70, this becomes a major concern. The U.S. Preventive Services Task Force and many international health organizations do not recommend routine PSA screening for men older than 70 because studies show it often leads to overdiagnosis and overtreatment without improving lifespan or quality of life. When the test causes more harm, let's take an example. Mr. Ahmed, a 73-year-old retired banker, was active and enjoyed morning walks. His doctor ordered a PSA test during a general checkup, just to be safe. The result came back slightly high, prompting further tests, an MRI, then a biopsy. The biopsy caused bleeding and infection, and the emotional stress of waiting for results was unbearable. When the final report arrived, it said, slow-growing tumor, no urgent treatment required. He went through months of fear for a condition that likely would never have harmed him. This story is not rare. In fact, up to 60% of prostate cancers detected in men over 70 are so slow-growing that they would never cause symptoms in their lifetime. Yet many undergo surgery, radiation, or hormonal treatments that cause serious side effects, including urinary problems, erectile dysfunction, fatigue, and depression. The science behind the change. You might wonder, but isn't early detection always good? Here's the scientific truth. Studies from Harvard and Johns Hopkins have shown that routine PSA screening after 70 does not significantly reduce death rates from prostate cancer. What it does increase, however, is anxiety, unnecessary biopsies, and complications from treatment. Our immune systems, metabolism, and healing capacity all slow down with age. So, what may seem like a minor procedure at 50 could be risky at 75. Even a simple biopsy can lead to infections or bleeding that take weeks to heal. Doctors today encourage a more thoughtful approach called shared decision-making. This means that before any test, the doctor and patient discuss the potential risks, benefits, and personal goals of care. For many healthy seniors, focusing on lifestyle, diet, and regular physical activity offers more benefit than chasing every lab result. What to do instead? Instead of routine PSA screening, here's a better path. 1. Stay aware of symptoms. Painful urination, blood in urine, or unexplained fatigue should always be checked. 2. Adopt a prostate-friendly diet. Tomatoes, green tea, pomegranate, and cruciferous vegetables like broccoli support prostate health naturally. 3. Maintain good hydration. Proper fluid intake keeps the urinary system healthy. 4. Stay active. Regular walks, pelvic floor exercises, and stretching improve blood flow to the pelvic area. 5. Get individualized advice. If you have a strong family history or prior issues, talk to a urologist about a tailored plan. The goal isn't to avoid doctors, it's to avoid unnecessary fear. Balanced perspective. Medical tests can be powerful tools when used wisely. The key message is not never test, but rather test smart. If a test doesn't improve your longevity or comfort, it's worth rethinking. At age 70 plus, peace of mind, functional strength, and emotional stability are the pillars of health. As one geriatric specialist beautifully said, at some point, we stop chasing diseases and start chasing joy. In the next section, we'll talk about the second common test seniors over 70 should avoid, and this one affects both men and women. For decades, colonoscopy has been seen as a gold standard for preventing colon cancer, and rightly so, for younger adults and middle-aged people. It helps detect precancerous polyps early and has saved countless lives. But once you reach your 70s and beyond, the equation changes. The benefits of colonoscopy start to shrink, while the risks quietly increase. In fact, many leading organizations, including the American Cancer Society, now recommend stopping routine colonoscopy after age 75 for most healthy adults, and for those with chronic illnesses or frailty, even earlier. Let's understand why. Why colonoscopy can be risky after 70. A colonoscopy is an invasive test. It involves inserting a flexible tube with a camera through the colon to look for abnormalities. While it's generally safe, the preparation and procedure can pose real challenges for older bodies. Here are the main concerns. 1. Sedation risk. Seniors metabolize anesthesia differently. Sedatives can cause confusion, memory lapses, or even falls in the days following the test. 2. Dehydration and electrolyte imbalance. The bowel cleansing process before the test often causes dehydration, weakness, or dizziness, especially dangerous for people with heart or kidney issues. 3. Perforation or bleeding. The risk of tearing the colon wall or internal bleeding increases significantly with age. 4. Limited benefit. Most colon cancers take 10 to 15 years to develop. Detecting a small polyp at 75 may not improve lifespan compared to the discomfort and risks of the procedure itself. A real-life story. Mrs. Salima, a 76-year-old grandmother, was asked by her doctor to do a routine colonoscopy. She had no symptoms, just a standard check. During preparation, she became dizzy from dehydration and fainted, leading to a minor head injury. The colonoscopy later revealed a small, non-cancerous polyp that required no treatment. Her recovery from the fall, however, took weeks. Her story mirrors that of thousands of older adults who suffer complications from a test that may not have been necessary. What the research says. A 2022 Harvard Medical Review found that the risk of serious complications from colonoscopy nearly doubles after age 70, while the actual detection of life-threatening cancers drops sharply. Another study from the DEXA Journal of the American Medical Association, JAMA, reported that routine colonoscopy in adults above 75 offers minimal additional benefit, especially for those who have had prior negative screenings or no symptoms. That doesn't mean older adults should ignore digestive health, far from it. It just means the approach needs to shift from routine screening to symptom-based care and non-invasive options. Safer alternatives. Here are some gentle, science-backed alternatives for seniors who still want to monitor their colon health. 1. Fecal immunochemical test, FIT, a simple stool test done at home once a year that detects hidden blood. No hospital visit, no sedation. 2. Stool DNA test, Cologuard, a newer, non-invasive test that checks for DNA changes linked to colon cancer. 3. Symptom monitoring. Watch for signs such as unexplained weight loss, persistent constipation, or blood in stool, and consult your doctor promptly if they appear. 4. Diet and lifestyle. A high-fiber diet, regular hydration, and daily physical movement are proven to reduce colon cancer risk naturally. These methods are generally safe and effective for seniors, offering peace of mind without unnecessary risk. Reframing prevention. For many older adults, true prevention isn't about endless testing. It's about preserving energy, comfort, and independence. A 74-year-old woman who maintains daily walks, eats balanced meals, and manages stress is often doing far more for her long-term health than someone chasing every screening on a checklist. The best medicine at 70 plus isn't in a test tube. It's in movement, nutrition, joy, and rest. As one longevity researcher beautifully said, at some age, the goal shifts from avoiding death to embracing life fully. In the next section, we'll explore another common test, one that affects both men and women, which may be unnecessary or even risky after 70, the bone density DEXA scan. After the colonoscopy, the next checkup that many seniors continue to do, often unnecessarily, is the bone density scan, also called the DEXA scan. Now, before we go further, let's be clear. Bone density testing can be very helpful for diagnosing osteoporosis, but after age 70, repeating it routinely every year or two may not offer much benefit and can even lead to overmedication. What the DEXA scan does. A DEXA scan uses low-dose X-rays to measure how strong or weak your bones are, particularly in the spine and hips. If the reading shows low bone density, doctors may prescribe medications to prevent fractures. However, here's where the problem begins. Bones naturally lose some density with age, and not every change needs treatment. Most medical guidelines, including those from the National Osteoporosis Foundation, suggest that if your initial scan is normal and you have no major risk factors, you may not need another scan for 5 to 10 years. Yet many seniors are advised to repeat it every year, leading to unnecessary radiation exposure and anxiety. When treatment becomes a trap, medications for osteoporosis, especially bisphosphonates, can indeed help prevent fractures. But overuse or long-term use without genuine need can cause side effects, like jawbone problems, digestive issues, or even rare fractures caused by the drugs themselves. Take Mrs. Qureshi, a 72-year-old woman who was told her bone scan showed slight thinning. She was started on strong medication. Within a year, she began experiencing jaw pain and reflux, side effects of the drug. Later, another doctor told her she never really needed medication in the first place. Her bone density was within normal limits for her age. This kind of overtreatment happens often because we confuse aging naturally with aging unhealthily. What really protects your bones after 70? Science now shows that movement is medicine, especially for bones. Weight-bearing exercises like brisk walking, light resistance training, and even gardening can keep bones strong. Here are research-backed ways to naturally maintain bone strength after 70. 1. Daily movement. Walking, dancing, or light-strength exercises stimulate bone-building cells. 2. Vitamin D and sunlight. Spend 15 to 20 minutes in morning sunlight several times a week. 3. Calcium-rich foods. Include yogurt, sesame seeds, almonds, spinach, and sardines. 4. Avoid smoking and limit alcohol. Both weaken bone tissue. 5. Balance exercises. Yoga or Tai Chi improve coordination and prevent falls, the real cause of fractures in old age. Emotional wisdom. Redefining health after 70. At this stage of life, health isn't about chasing perfect numbers. It's about feeling steady, mobile, and at peace in your own body. You don't need to fear every wrinkle or every drop in a test report. Remember, aging bones are still living bones, capable of healing, adapting, and getting stronger with consistent care. If you spend even 20 minutes each day stretching, eating wholesome food, and staying positive, your body rewards you in ways no pill can. The bigger picture. Let's take a step back. We've now discussed 3 major tests, PSA, colonoscopy, and DEXA, that often lose their benefit after 70. The message is not to reject medicine, but to embrace balance. Healthcare in later years should be about quality, not quantity. The question isn't how many tests can I do? It's which tests will truly improve how I live today. As one senior doctor beautifully said, medicine is for living well, not just for living long. When you shift your focus from disease prevention to vitality promotion, life feels lighter, calmer, and more joyful. Because in the end, your best medicine might be laughter with your grandchildren, morning sunlight on your face, or a shared meal with someone you love.